Thank you. Can you also go back to the epidemic curve, which showed, and I think you said 2 to 3 weeks before these numbers are charted, something happened. In other words, that was the incubation period and the testing period. It looks like March 23rd, you have the largest number of reported positive cases. So the incubation period for anybody who had met somebody or somebody in the family or somebody was infected around those was 2 weeks, and then you said 2 to 3 weeks. So I'm assuming 2 weeks of incubation and a week of testing, right? Okay.
Reporting.
I'm sorry?
There's a delay between when someone develops symptoms, they get tested, and then they're reported to public health for
Thank you.
investigation. Yeah.
So what happened, in your opinion, so the first press conference you had with all of us at Hazen Drive was a couple of days after your first positive at the end of February. So if you go back to the largest numbers of cases that have been reported, which looks like March 15th, March 18th, and March 24th, do you have any information on what happened between the 2 to 3 week period of those period, which takes us into February, before the first case was reported in the Grafton County case, and then the person who knew the Grafton County case?
Let me first clarify one thing. These are date of illness onset. So someone can be tested a week or two later. We graph this based on when the person reported developing symptoms. And so I think what you're going to see, this is what I was referring to earlier, is that you're going to see natural variation in these numbers. They're going to go up, they're going to go down, they're going to go back up, they're going to go down. So the ups and downs are expected. What causes the ups and downs, most of the time, it's difficult to say. One thing I can mention is that obviously testing is going to impact the number of cases that we identify. And so if you look at this graph, we were ramping up testing during that time. Our peak date of testing was, these were the dates that the results were reported, was at the end of March. So these higher numbers are actually before we had ramped up, or testing had peaked, so to speak. But testing can certainly influence these numbers. Whether that was what contributed to these higher numbers on specific days, it's difficult, if not impossible, to say.
We're also clearing up the backlog.
Right, we were also clearing up the backlog of some of the testing that we had done.
One of your predecessors described epidemiology as a disease detective. What can you take a minute and just describe what, if any, process you and your team go back through? Okay, everybody's now well. Do you then go back and start re-interviewing everybody to find out how all of this came? Because the first cases were in Grafton, and how they go from, everybody came back from Italy on school vacation, and then you have half the deaths in the state are from living care facilities. That doesn't really have, Grafton County trip, school vacation trips, half the deaths in living care facilities. There's almost no connection, it seems, how all those people got sick and died based on that. Do you know what I'm saying?
Yeah, so,
okay.
so the question is, if I can rephrase this and repeat it for everybody to hear, is that how do we conduct these public health investigations and try and connect cases? How do we make that connection? And that is in fact what we tried to do. Certainly we were doing that early on, and I can say that our public health team continues to investigate each and every confirmed case of COVID-19 that is reported to us. Because of the volume of infections, many other states have done away with those types of investigations. We continue to have a group of people that conduct those investigations. Early on, we try and make those connections, but when we have a pandemic like this, it becomes impossible to be able to make connections between each person and figure out where exactly they got it from. Certainly we ask about risk factors when we do these investigations. We ask about travel, although there's risk in our own communities for acquiring COVID-19 because we believe it's more widespread. We ask about whether someone was a contact or close contact to someone with confirmed COVID-19. But at the end of the day, as this virus becomes more prevalent in our communities, the identified risks, we become less able to identify these connections. And so that is something we try and do, especially early on, or when there's limited outbreaks, for example, other viruses, mumps and measles, and we try and make these connections because it helps us trace back the chains of transmission and contain the infection. But in this case, the goal is no longer containment of the virus. The goal is to slow the spread. And if we can be effective in our social distancing so that for each person who becomes for each person that becomes infected, fewer than one additional person becomes infected, that's how we suppress the outbreak and get it to stop.